Dear students, next to the skin and the fascia of the foot, we find the muscles of the foot, the extrinsic muscles of the foot and the intrinsic tendons entering from the leg, the long muscles, they send their tendons in the foot for their proper function. And the intrinsic muscles which arise in the foot and inserts in the foot, these are called the intrinsic muscles. So by now we are going to discuss the muscles of the foot, the extrinsic or the intrinsic muscles. The extrinsic muscles, were responsible for eversion, inversion, plantar flexion and the dorsiflexion of the foot. The intrinsic muscles, they are responsible for fine motor actions of the foot and the movement of individual digits. In the sole of the foot, there are multiple muscles and they are arranged in 4 layers. The total number of muscles are 10 and they are arranged in 4 layers. The first layer contains the abductor hallucis muscle, flexor digitorum brevis muscle, abductor digiti minimi. The second layer contains the quadratus plantae and the lumbricals muscles. The third layer contains the flexor hallucis brevis, adductor hallucis muscle and flexor digiti minimi brevis muscle. The fourth layer contains the plantar and the dorsal interossei as were there in the hand. Students, on the dorsal aspect of the foot, there are 2 muscles, the extensor digitorum brevis and the extensor hallucis brevis muscle. They assist some of the extrinsic muscle tendons. Their nerve supply is from deep fibular nerve. So the extensor digitorum brevis muscle, it is deep to the tendon of extensor digitorum longus muscle. You can see the black tendons in the diagram on the right side, underneath which is the red muscle. That is the extensor digitorum longus, the black one, and the extensor digitorum brevis is the short muscle of the intrinsic muscle of the foot, which arises from the calcaneus and talocalcaneal ligament. Its insertion is in the long extensor tendons or the dorsal digital expansion on the dorsum of the middle phalanges, at the base of the middle phalanges, and its action is it assists the extensor digitorum longus and extends medial 4 toes at the metatarsophalangeal joint and the interphalangeal joints. Its nerve supply is from the deep peroneal nerve and its blood supply is from the dorsalis pedis artery as is shown in the diagram on the right side. Now the extensor hallucis brevis muscle, it is medial to the extensor digitorum longus muscle tendon and lateral to the extensor hallucis longus muscle tendon. Its origin is from the calcaneus bone, the talocalcaneal ligament and the inferior extensor retinaculum. It inserts at the base of the proximal phalanx of the great toe in the dorsal digital expansion. Its action is it assists the extensor hallucis longus in extending great toe at the metatarsophalangeal joint, and its nerve supply is from the deep fibular nerve. Now coming back to the plantar aspect, we have 10 intrinsic muscles and they are similar to corresponding muscles of the hand. Their collective action is to stabilize the arches of the foot, the longitudinal arches, the medial and the lateral and the transverse arch. and the individual action is to control the movement of the digits. Their nerve supply is from the medial and the lateral plantar nerve. Both of the medial and lateral plantar nerves are the branches of the tibial nerve. And you know tibial nerve is the branch of the sciatic nerve. And the tibial nerve supplies the flexors. The peroneal nerve supplies the extensors. Now, the arrangement of the muscles is in 4 layers, and these layers are arranged from superficial to deep. Now, the first layer of the muscles of the sole of the foot, these are 3 in number, most superficial to the sole, just beneath the plantar fascia, and these are, you can see, the abductor hallucis, the yellow one. The red one is the flexor digitorum brevis to all digits, and the abductor digiti minimi, which abducts the small toe. Now the muscles one by one. Abductor hallucis muscle. On the medial side it is situated. Small soft tissue bulge you can see on the surface, and it arises from the medial calcaneal tubercle and the flexor retiniculum and the plantar aponeurosis. Its insertion is upon the base of the proximal phalanx of the big toe, as you can see, and the actions is to abduct and flexes the great toe. The nerve supply is the medial plantar nerve. The flexor digitorum brevis muscle arises from medial calcaneal tubercle and the plantar aponeurosis. It inserts upon the middle phalanges of the lateral 4 digits. Its action is to flex the interphalangeal joint, the proximal interphalangeal joint, and it assists the long flexor tendons, and its nerve supply is the medial plantar nerve. The abductor digiti minimi arises from lateral and medial calcaneal tubercle and the plantar aponeurosis, and at the base of the proximal phalanx of the 5th digit it inserts and it abducts the and flexes the 5th digit. Its nerve supply is from the lateral plantar nerve. The second layer is composed of quadratus plantae, the lumbricals. In addition to these two muscles, the tendons of flexor digitorum longus and the flexor of tendon of flexor hallucis longus is also present in this layer. In between the first and the second layers of the sole of the foot, the lateral plantar vessels and nerves, they are lying and they separate both of the groups of muscles. So the quadratus plantae is the first muscle in the second group, and it arises from lateral and medial calcaneal surfaces. Its insertion is in the tendons of the flexor digitorum longus. You can see in the diagram shown by yellow tendons. The action is to assist the flexor digitorum longus tendons, and the nerve supply of this muscle is lateral plantar nerve. The lumbricals are 4 in number, and each arise from the medial side of the respective flexor digitorum longus tendons. If you remember, the lumbricals of the hand were arising from the tendon of the flexor digitorum profundus. The insertion is in the extensor hoods of the lateral 4 digits. Its action is to flex the metatarsophalangeal joint and extends the interphalangeal joint. The nerve supply is the medial by the medial plantar, and the remaining 3 by the lateral plantar nerve. The third layer of the muscles of the soles of the foot. It contains three muscles: the flexor hallucis brevis, the adductor hallucis, and the flexor digiti minimi brevis muscles. The flexor hallucis brevis muscle, it arises from the cuboid bone and the lateral cuneiform. It inserts at the base of the proximal phalanx of the big toe, and its action is to flex the proximal phalanx at the metatarsophalangeal joint, and its nerve supply is from the medial plantar nerve. The adductor hallucis muscle, it arises by two heads, the oblique head and the transverse head. The oblique head, and it is shown in the diagram as well, arises from the basis of the first four metatarsal bones. The transverse head arises from the plantar ligament of the metatarsophalangeal joints. The insertion is at the base of the proximal phalanx of great toe, and its action is to adduct the toe. It assists in forming transverse arch. The nerve supply is the deep branch of the lateral plantar nerve. The flexor digiti minimi brevis muscle. It arises from the base of the fifth metatarsal bone and inserts upon the base of the proximal phalanx of fifth digit. Its action is flexion of the proximal phalanx of the fifth digit, and its nerve supply is the superficial branch of lateral plantar nerve. The fourth and the last layer is formed by the plantar and the dorsal interossei. The plantar interossei are unipinnate and the dorsal interossei are bipinnate. The plantar interossei are three in number and occupies the space between the metatarsal bones. They arise from medial side of the third, fourth and fifth metatarsal bones. The insertion is on the medial side of the phalanges of third, fourth and fifth digits. Their action is to adduct third, fourth and fifth digits and flex the metatarsophalangeal joints. Their nerve supply is the lateral plantar nerve. The dorsal interossei are four in number and they lie between the metatarsal bones, and they arise from the sides of the first to the fifth metatarsal bones. The first insert upon the medial side of the proximal phalanx of second digit, the second, third and fourth on the lateral sides of the proximal phalanges of the second, third and fourth digits. Their action is to abduct the digits, the second, third and fourth, and flex the metatarsal phalangeal joint. The nerve supply is lateral plantar nerve. Here's the last item. The plantar and dorsal interossei were the same as those of the hand interossei, the palmar and the dorsal interossei, in both in structure and in function. Thank you very much. May you have good time. Next time we will meet with another interesting topic. Thank you very much.